Welcome back to Consider This. Melissa and Sharad here with you, and we are joined by Datuk Latif from MPC, as well as Datuk Dr Jacob Thomas, who's the champion of the Private Healthcare Productivity Nexus, a collaboration between the private sector and the public sector in increasing the productivity of the healthcare sector. Now, we've touched just before the break about the idea of making it easier for regulatory approval to set up hospitals. Within the regulatory framework of the healthcare sector, there's also, something that I discovered which was quite interesting, the reason why hospitals cannot be built above 12 stories. I never noticed it until it was pointed out to me. Latif, do you want to set the scene for us a little bit?
Okay. You see, we do have regulations in place, but over time regulations may not be appropriate anymore. Yes. We need to review it. So I think in the last session I mentioned about the National Policy on Good Regulatory Practice. Regulations which are more than 5 years old, they are subject to review. So that is where I think we need to do a lot of engagement with the business community. They will tell you, how difficult to do business in Malaysia. So of course, like the private, private hospital, development private hospital, these are things that we engage with the private sector. They tell us. And when we do verification, with the regulators, which are basically the government agencies, yes, it says that you cannot be a hospital more than 12 stories. So it was interesting through the Nexus. I think they organized visit. They look at how other better countries. They went over to to Hong Kong, and they saw that that country could build 38 stories. All right, and we learned from that. Bringing back here.
So this is an almost obsolete regulation, right? Because times have changed, equipment's changed, technology has changed. Yeah. We're able to, I guess, provide more disaster management plans and have high-rise hospitals, which you saw, Jacob, in Hong Kong.
Yeah, actually, why the need came up, it's not just because we wanted a very tall hospital, because land became more scarce. And we had a luxury of availability of land in the past, but that got less and less. So we had developers in areas like Kuala Lumpur, Shah Alam, Johor asking, we want to build a hospital, but we don't have enough land. We want to go higher. So that's where the restriction came when you wanted to build a hospital higher than 12 floors.
Jacob, can I ask you, before this initiative and the work of the National Productivity Council kicked in, how was the process? I mean, surely industry was going to government saying there's too much red tape, these laws are obsolete. Were your criticisms or your feedback falling on deaf ears before that?
It was. I must say that. I can bravely say that because I was the president of the Association of Private Hospitals.
You were giving the complaints.
We were giving the complaints, saying it is too rigid. You are not listening to us. These are laws of 1971, or it doesn't apply today. We need changes, but it just fell on deaf ears, as you said. But now I am sitting as a person from within with the support of MPC, and if you go all the way around, it goes right up to the National Productivity Council, which is headed by the Prime Minister, who's listening, and they have said, we will work around the issues you have because productivity is the end game. And so because of that, people are listening and changes are being made.
Okay, well, it also, I guess, because he's a medical doctor himself, perhaps.
I do want to ask, though, is change only possible or enabled when we have the Prime Minister's hand in the mix? I mean, is Malaysia one of those countries where you can't have initiatives and good sense emanating from middle-ranking officers or even from the ground up? Why does it require the Prime Minister to be there in order for change to happen?
I think people want to change, but at times they don't know how to change. Now we come in to facilitate. So what we do is that we do verification. We hear complaints, all right, and then we gather all the information. We do verification, all right. We map out the whole process, and then we start asking and compare with the best practice elsewhere. And then we realize that we do have gaps. We do have unnecessary regulatory requirements. So we started challenging and bring all these different people and ask ourselves, can we change? But we have to work, not just among us. So the private sector together with the government. The private sector will tell you real issues that they face. Okay. Government may not know because government just introduces regulation. So we have to bring them together, and we realize that we can change together.
But I must say
Sure.
this, even before it reached the Prime Minister, before that I had to go through the Minister of Health, I had to go through the MITI Minister, I had to go through the MEA Economic Affairs Minister. They all thought that we had valid points and they endorsed it. And by the time it came up to the Prime Minister, it was quite certain that we had the support of all these people, but he stamped it because I think he could really see how much it was needed, and he supported us fully.
I want to come back to a point that you made, Latif, about the government being the regulator, right? Healthcare is, I guess, a different type of animal because, again, as Shira talked about, it's a public good. Now, the government's role as regulator, in the healthcare sector, is again to safeguard, the public's interest. While listening to feedback from the private sector, not necessarily just profit-driven, I'm wondering in the area of, say, for instance, one of the things that you brought up, Jacob, in your I guess, recommendations to the government is a relook at the private healthcare advertising landscape. So the idea is to have a more self-regulatory system as opposed to, black and white. Can you tell me why this is an area that is going to benefit the public? So why should the government loosen regulations on healthcare advertising?
You see, the main issue affecting private hospitals is the delays when it comes to applying for permission to advertise. The regulations here are very strict, whereas when we look at our neighboring countries, many of them self-regulate, which means that if I want to come up with an article in a magazine, it has to be vetted by the division in the Ministry of Health. And that could take some time. And then they say, okay. And then if you want to change it, you have to go again and spend time to get that done. So what we are saying is, why do you want to do it? And that division finds it difficult to cope with the volume of work. So we said, we will self-regulate, you give us the guidelines, you give us the criteria, we will follow that. If we flout that, then you come after us.
Is that an area where the public's good is the public's
because
interest?
what is happening is, if we don't advertise, there are Malaysians who are going to neighboring countries for treatment, and when they go there, they are told, hey, your hospitals have got the latest. They don't know, and we are not allowed to advertise.
So I'm wondering if this is the best way to understand what's happening, that we are looking at the increased productivity of the Malaysian private healthcare system in relation to the global provision of services, right? And so the question is, are those global standards the ones that we want to peg ourselves to? Where are they best, and where they might in fact be so loose as to not protect the public?
I would agree there that we don't want to say it's free for all.
Right.
We want to have certain restrictions. That's why I say you have criteria, you have guidelines, we follow them. We don't want the public to be hoodwinked and say you are the best, you are the... But if you have something which you want to shout out, tell us. One example I'll give you is, if you look at the websites of some of our neighboring countries, you have, every patient, whichever country he comes from, wants to see the face of the doctor. And we are only allowed to put a passport size photo of our doctor. Whereas if you look at some of the neighboring countries, you have a doctor sitting on a couch, looking good, and he gets a lot of patients, and he is a plastic surgeon. So why not let our doctors have that privilege? Why restrict it? In fact, when I brought this up to the Prime Minister, he did agree with me that we have not changed from those early days where we restrict the amount we can advertise.
So doctors will be allowed to smile. I think it's very important. They'll be allowed to smile.
Not just the
And we have got
mugshots or the passport
size.
photo.
Wonderful. Okay.
We're going to come back and continue this conversation on Consider This. Make sure you stay tuned to Astro AWANI.